We're going to go ahead and get started. It's 12 o'clock. Today's youth vaping prevention session is called Youth as an Equity Deserving Community, Marketing Tactics that Prey on Youth Vulnerability. This is the fifth session of our Project Echo series focused on youth vaping prevention, and we will gain insights into best practices and share our collective experiences today. I'm Sarah Kondrak. I have the pleasure of hosting the first Project Echo Hub dedicated solely to the behavioral health prevention workforce. There are over 1,400 hubs across more than 200 countries, and we're proud to bring this innovative model to Ohio as a resource for our prevention community. Thank you for joining us. So the Echo Hub is facilitated by the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, and you can visit our website listed on this slide to learn more about the center's work. The center is funded by the Ohio Department of Mental Health and Addiction Services and administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation. So what is Project Echo? If this is your first time at an Echo session, welcome. We are continually growing and we're so glad you're here today. At the heart of Project Echo is the philosophy of all teach, all learn. Each session kicks off with a presentation from an expert on a topic, followed by a community member sharing their work and experiences. What makes Echo so unique and effective is that everyone here brings their own knowledge and experience, and we get to learn from one another during the discussion portion in the latter half of the session. So why the Echo model? On this slide, we're highlighting some of the key benefits of Echo. Notably, the model democratizes access to information and expertise quickly. That means that knowledge is shared equitably, ensuring that everyone, no matter their professional network or their location, has access to the latest best practices. Echo ultimately builds workforce capacity by empowering professionals across different sectors with the skills and knowledge they need to make an impact. So some tips for today, please mute your microphone when you're not speaking. And it is the lunch hour Eastern time. If possible, please turn your cameras on. So mics off, cameras on if possible. We really want to see your faces and connect to build relationships with our colleagues. Would like to encourage you to use the chat feature throughout the session. Would love resources that you have and you want to share with your colleagues. We'll capture all of those and add those to notes at the end of the session for you to access in iEcho. Finally, please reach out to my expert colleague, Nancy Clough, if you're having any technology issues. Nancy's email is on the side of the slide here, and you can reach her in the chat as well. So we have an incredible hub team that's responsible for ensuring that the series meets your needs. You can identify the hub by looking for the white background with the Echo logo. And as a hub team, we're committed to creating an inclusive environment and providing all necessary accommodations. We'll start and end sessions on time and make good use of your time. The only recorded part of this session will be the didactic presentation, and this is out of respect for your privacy and the community members that you serve. So we also ask our participants to help us create a safe and respectful learning environment by valuing the opinions of your colleagues, using inclusive language, and protecting the privacy of everyone involved by keeping our discussions confidential. We encourage you to be open and sharing your experiences, knowing that this is a supportive space. So while the Echo model is not new, the iEcho platform that it's housed on is relatively new. In order to be here, each of you have created an iEcho account and have access to all of its features. The iEcho schedule view on this slide should look familiar, and I wanted to point out a couple of helpful tabs. First, the content tab is a great place for you to find all of the resources listed in one spot for the entire series. So all of the previous sessions that we've had have resources listed in this content tab. You can also find session-specific content, such as the didactic slides and resources in the schedule tab shown in the screenshots. Next, the discussion tab gives you access to an announcement board where we post articles. If you want to email me an article to post in this discussion board, I'm happy to do that. And we also have a conversation board if you're interested in continuing the discussion after the session is over. Please feel free to explore those features and access all of the great content that we've captured for you after the session. And finally, I'd like to remind you about the schedule for our upcoming sessions. We currently have 3 active monthly Echo series, and we're launching a 4th next month. Continuing education credits are offered for each of our live sessions by completing the evaluation. That will be, there will be a link in the chat at the end of the hour. And please note that CEs will not be automatically uploaded to CE Broker, so be sure to self-report directly to your respective boards once you receive your certificates. And with that, I would like to introduce you to our didactic presenter, Dr. Megan Roberts. Dr. Roberts is an associate professor in the College of Public Health at The Ohio State University in the Division of Health Behavior and Health Promotion. Her research focuses on tobacco use among populations historically targeted by the tobacco industry, including adolescents and young adults, racial ethnic minorities, and individuals living in rural areas. As a social scientist, her research methods include longitudinal surveys, ecological momentary assessment, focus groups, and community mapping. The ultimate aim is to better understand the factors that contribute to tobacco initiation and tobacco-related disparities, as well as how such factors can be targeted for prevention. Welcome, Dr. Roberts. We're so excited to learn from you today.
Thank you. Very happy to be here. All right, we're gonna see if I have still the skills to share my screen. All right, everybody see the main slide there?
And
Great. Okay, so thank you again for having me. Today I'm going to be talking about youth as an equity deserving community and marketing tactics that prey on youth vulnerability. Before I get going, I want to acknowledge my many collaborators and students who have worked with me, the funding that supported this work. I don't have any disclosures or conflicts of interest otherwise. And I also want to acknowledge the James Cancer Center. We have a Center for Tobacco Research where I do a lot of my work as well. So that's our team there. Even though I am seated in the College of Public Health, I do a lot of work with the James as well. Okay, so just to briefly set the background for what we're going to be talking about, I'm sure most of you are aware that most tobacco use begins during adolescence. So most people who have become people who smoke cigarettes regularly started before the age of 18. And it's a time when, most initiation begins. When initiation does begin during young adulthood, it's usually during college. And this is just a period developmentally where people are more receptive to social norms. They're more susceptible to environmental cues, and this can make marketing impacts really pronounced. And it's also a period developmentally where our brains are more sensitive to nicotine, and that means that the likelihood of developing nicotine addiction is going to be stronger than if you started at a later age. So the good news is that we're seeing a downward trend in youth tobacco use. So this figure here is showing you that main blue dotted line is cigarette use, other tobacco product uses that have been captured in national surveys among high school students. So cigarette smoking peaked in the US around the 1990s, and it's been declining since then. Unfortunately, we saw then this kind of surge in tobacco use led by e-cigarette use starting around 2018, but that again seems to have been going down in the past year or so. So taking a very public health approach, this diagram is formally called the socio-ecological model. We can conceptualize the many factors that influence an individual's behavior, like tobacco use, being in kind of these different nested levels. So at the intrapersonal or interpersonal level, we have factors like sensation seeking, right? Just individual differences in kind of risk kind of behaviors, like trying a cigarette. Or peer and family use, right? Parental use is one of the strongest predictors of whether a young person will begin using themselves. At the next level up, we have kind of more institutional level, like what the local health department is doing, what the enforcement agencies are doing, right? Are they allowing retailers to sell to underage people? We have kind of the broader environment, which is generally where marketing is considered, and things like retailer density, which I'll be talking about. And then at the broadest level, we have policy, so things like the Tobacco Control Act or Tobacco 21. Today, I'm going to be talking about tobacco marketing and how that influences youth. And it's important to recognize that the tobacco industry uses a variety of methods to promote their products directly to young people and has done so for decades, as illustrated by this poster here. Um, you can see in my note at the bottom there, a lot of the example pictures I'm going to be showing are from the Stanford research group that has this wonderful database of images on the impact of tobacco and advertising. So I would encourage you all to check that out. So I also want to note that marketing itself is not bad. Marketing is used by nearly all companies to sell many, many types of products. And it's often done by appealing to our wants or our emotions, right? So ads that will make us feel cool, or if we buy this thing, that could help us be more attractive, right? Or kind of buys into the type of person who I want to be. And often marketing companies pursue specific audience. So maybe they're looking to target a specific group with their product or expand to a new group of people. So I'm sure if you look at this picture, you might make some guesses as to what this ad might be selling, right? Who are they trying to sell it to? Or, who is this product for? So targeted marketing is not inherently bad, but it is a problem when you're selling an addictive and deadly product. And even more so when you're targeting with your marketing a population that has less of a voice or is less equipped to stand up against that type of targeting. So when we talk about tobacco marketing, this has historically been things like magazines, TV, radio, and billboards. Um, I'm sure many people on the call, depending on your age, can recognize this guy. Probably if you're my age or older, he looks familiar. So this is Joe Camel. And he was a cartoon camel who was used to sell and be in ads for Camel cigarettes. And a study was actually conducted in the early 1990s that demonstrated how well Joe Camel was reaching children. So this study found that by age 6, children as young as 6 were just as good as recognizing Joe Camel as they could recognize the Disney logo. Right, so this was really just showing us that Joe Camel was being picked up, it was being tracked by young people. More recently, we've seen the mediums for tobacco marketing spread to social media, popularized by Juul and their very successful campaign on Instagram. Lots of ads like these we saw, in 2018. We actually captured kind of what was going on during that time on our Ohio State University campus. So we just happened to have collected a survey of a cohort of incoming freshmen in 2016. Less than 6% were using e-cigarettes that year. Then after Juul hit the scene, we saw that nearly a quarter of them. So you can see there's freshmen there. So those were new freshmen in 2018. And that bar for juniors, those are the people who were the same freshmen in 2016. So we recontacted them. So use was going up drastically around 2018 with e-cigarettes. And then when we asked about the brand, it really was being driven by Juul. And again, they had this really compelling marketing campaign on Instagram. I also want to point out that marketing to young people often intersects with other vulnerable groups. So often that can include marketing to young Black people. There was a horrible series of marketing campaigns by many menthol brands around the 1970s, 1980s called the Menthol Wars, where they were taking some of their campaign involved bringing vans, blasting hip hop music, handing out free cigarettes to children in inner cities, including in Columbus. And there's also been a lot of targeted marketing to the LGBTQ community as well. So that intersection between youth as well as other marginalized identities. We're also seeing now new products being promoted by influencers, which is a little harder to pinpoint, right? Because sometimes an influencer's um, financial impact or financial connections are unclear. This is actually from Zyn itself, but we're seeing a lot of Zinfluencers promoting those products. So, although today we're going to be all talking about e-cigarettes and the many different types, I also just want to point out that the landscape of tobacco is always changing, and now we're dealing with oral nicotine pouches like Zyn as well becoming popular. Right. Another point that I want to make is that big tobacco is behind almost everything. So when I say big tobacco, these are around the four. There's also a couple more main ones, but these are the big four tobacco companies. So Philip Morris International, British American Tobacco, Japan Tobacco International, and Imperial Brands. And when I say that they're behind almost everything, that's because a lot of the same companies that own cigarettes are also owning vaping companies. So, to give you an example, British American Tobacco owns Camel cigarettes, Newport cigarettes, Vuse e-cigarettes, and many, many other products too. These are just some examples. Philip Morris has Marlboro cigarettes, IQOS, Zyn, and until very recently, they also, their conglomerate was owning Juul as well, though they dropped them in 2023. So we're monitoring these trends here at Ohio State University with the Gen Z Health Study. We're actually actively recruiting and trying to enroll people who use e-cigarettes into our study and also nicotine pouches. So if anyone is interested in connecting with me about that recruitment, I'd be very happy to talk. Right now, we're seeing most popular e-cigarette brands, and this is a national study, I should mention. Geek Bar is now really starting to take off. Juul, Puff Bar, Vuse, Elf Bar, Breeze are some of the main ones. All right. So I want to go now a little more in depth about one particular type of marketing, which is retail marketing. So this is marketing at the retail point of sale. So this can be what's going on inside the store, including that power wall that you see behind the clerk at the front desk, and also what's going on outside the store. So this is a picture I took when out and about, and it's just amazing how many ads are often posted kind of even outside the store. And this means that people don't even have to be going into the store in their community. They might just be going past it, going outside, getting gas in their car, and they're being exposed to tobacco marketing. And what we've found through a series of studies, and many others have corroborated this, is that young people are noticing these ads, especially the ones that are designed to be appealing to them. So, for example, we used an eye tracking task where we got a whole bunch of pictures from places outside Columbus, so different stores in Columbus, and then brought people into the laboratory where they looked at a series of ads on a computer that had an eye tracking machine, as kind of shown in this picture here. So it was tracking where on the screen, where in the picture they were looking. There are two versions of storefront scenes that they were looking at. One where a flavored e-cigarette ad was inserted, and one where more of a tobacco flavored ad was inserted. So hopefully it took you a minute to spot the differences between these two pictures. We actually kind of outlined them a bit for the purpose of this presentation. This is a within subject design, which means that everybody saw some flavored ads and some non-flavored ads, but it was counterbalanced. So nobody was seeing the same storefront in both conditions. What we found was that there were longer dwell times. So people were looking more at flavored ads compared to the non-flavored ads. So this is data from just one participant, and it's essentially a heat map. And you can see where those flavored ads are located. People were dwelling longer, they were looking longer. So it was drawing their attention and they were kind of reading it more. Right there. Okay. And then these are our statistical outcomes for those who are interested. We also showed people the same types of pictures inside an fMRI machine, where we looked at their brain activity. And what we found was that there was greater activity in the orbital frontal cortex, which is a brain area associated with reward, when adolescents who didn't even use e-cigarettes themselves were viewing ads for flavored versus unflavored ads. So these findings really underscore how e-cigarettes ads, especially flavored ones, hijack attention and the reward centers of the brain. And finally, there was an impact from experiencing these exposures. So we've run studies where people are filling out multiple surveys a day on their phone through a survey app, really quick, like 1 minute surveys. And what we found was that people who are exposed to more tobacco marketing, so when we ask them, have you seen any ads lately? And they're saying yes, they're also reporting more positive attitudes to those ads, higher expectancies to use in the future, and they have greater intentions to use tobacco in the future. So this work led me to also look into tobacco retailer density, because there's a lot of research out there, a very strong body of data showing that living in an area with greater density of tobacco retailers leads to more access to tobacco as well as more exposure to tobacco marketing, and that this can in turn distort perceptions about the availability and popularity of tobacco. So if you're just seeing more ads out and about, you're thinking, oh, that's, must be a very popular thing to do. Increases adolescent curiosity about tobacco use, increases the likelihood of smoking initiation, and also for people who are trying to quit, it impedes smoking cessation. So they're more likely to have a relapse if they're in a marketing dense area. And when I'm talking about retailer density, what I mean is the amount of places selling tobacco in a certain area. And so these don't have to be tobacco specific stores. They can just be any type of place that's selling tobacco. In fact, convenience stores are the most common type of tobacco retailer. When we've mapped this in Ohio, we see there are disparities in where these retailers are located. So for those of you from Ohio, you've probably seen this kind of urban effect, right? If you're aware of our main city centers, Columbus, Cleveland, Dayton, Cincinnati. We have this urban effect. So this is accounting for population size. This is per capita density. Even then, we're having more places selling tobacco in urban areas. And so this means more marketing exposure. Around them, you see kind of a lighter color, and that's showing us that there's less dense tobacco retailers there. This is kind of the suburb effect. In these areas that are generally more affluent, more advantaged, less tobacco retailer density. And actually, there's a rural effect as well. So accounting for population size, there's a greater density of tobacco retailers in rural areas. We've also started mapping this as other states as well. So if you're joining us from other parts of the country, we're starting to look also in California, North Carolina, and Connecticut. And there's a team of us with people from all 4 of these states who are examining tobacco retailer density there. In terms of the urban effect, I also want to point out that a lot of it is driven by poverty. So this is a map of Franklin County where Columbus is located, and it's showing you poverty rates. So darker red colors are showing you census tracts with a higher level of poverty. When you overlay this with tobacco retailer density, you can see how much of an association there is. And this is something that we've, of course, demonstrated statistically through spatial analyses. Okay, so where can we intervene, right? How do we deal with all of this tobacco marketing that's going on? Well, again, going back to our model, it's important to look at different levels of where we can intervene. So at the very individual level, we can look at things like media campaigns, warning labels, things that are going to impact and kind of educate people at an individual level. At more of an institutional environmental level, we can look at changing social norms. So even something like a tobacco-free policy where less people are using out and about, that can change our norms about what's popular, what's normative to do. And then broadly at the policy level, we can look at things that can restrict what's being sold, how it can be sold, where it's being sold, things like that. So I'm going to give just two examples of evidence-based ways to counter misleading tobacco industry messages, and I'm sure we'll talk about that more after my presentation. But the two examples I'm going to talk about are counter messaging and policy. So when we talk about counter messaging, these are just messages that are kind of anti-tobacco, right? When we're trying to have a campaign that's going to discourage tobacco use. So we've seen some very successful national campaigns by folks like CDC and the Truth Initiative, trying to give people good reasons to not vape, for example. And there's pretty robust protocols that are recommended now. So if you, for example, are at a health department or a school and you want to develop your own messages, this can be done pretty easily in a couple of phases. So phase one, you first start by developing a pool of messages and images. And this is, by the way, what marketers are doing on their side as well. So you're developing a set of messages. You can do this by reviewing research papers for evidence-based messages, right? I have an example here from Andrea Volanti, who has done a lot of great work in this area, and a lot of her supplemental tables in her research papers give great examples of messages that they found to be successful. You can make sure these messages cover topics that are shown to resonate with teens. So some of the most impactful themes are personal relevance, so making the message, personally relevant rather than community relevant. Anti-industry, so helping people be aware of how much the industry is trying to manipulate them, how it's trying to make money off of them, and talking about health effects. So people often think that young people don't care about the health consequences, but often they do, and often they just need some more information. And then when you're picking images, right? So if you're going to have a campaign, images can really help with getting attention and conveying the message, but the image should be aligned with the message content, right? It should kind of, they should make sense and go together. Phase two is pilot testing, and this can be really important. So pilot test with members of your target audience. If you are wanting to develop a campaign for your university campus, get some students to give you feedback. Young people especially, will be brutally honest about what they like, what they don't like, and listen to that and refine accordingly. So that's the last phase. Refine and repilot if needed. If they really hate everything you've developed, that's really important to know. Refine, repilot, and evaluate accordingly. I also want to point out a toolkit that one of my students, Christina Sadiq, developed. It's a really useful, I'm happy to share with anyone who's interested. And she kind of provides a lot of really useful kind of building block information for people who are wanting to run their own kind of small level social media campaign. She has suggested kind of themes and topics to cover. She goes over kind of, basic things like what's a hashtag, and then has a lot of great example images with kind of the explanation for why this is expected to work. Okay, and then finally, I'm just going to real briefly mention policy approaches. So off individual education is important and vital, but if we're talking about dismantling the structures that started this in the first place, we can't just address it at the individual level. We do have to think about policy level, and this can be things like banning cartoons in cigarette ads, which is now a policy that's in play. But it can also be local policies that are restricting retailer density and say things like, you can't have retailers close to schools, or you can't have more than one retailer per every 1,000 people in your area. And these are real policies that have been passed throughout the country. We've done research on what ones are most equitable. So where are they the most effective? My main takeaway from my research here is that pharmacy bans, which ban the sale of tobacco in pharmacies, not generally equitable. They usually help the suburbs the most, and kind of the richer suburbs. So if you do want to consider a pharmacy ban, please just incorporate other policies as well to make sure you're being equitable with your strategy. And I'm also pursuing new areas, new types of retailer density restrictions, including age restriction location policies. This has not yet come to the US, but it's been tried out in Europe, where you can make, they're looking into, for example, the Netherlands, only selling tobacco in tobacco stores and not in places like supermarkets or convenience stores. So happy to talk more about that if people have questions. But I am a little bit over time, so I will stop there. And thank you for your attention.